Good Friday morning. I'm Joe Fryer.
And I'm Savannah Sellers. Right now on Morning News Now, poor prognosis. More signs of a setback in the fight against COVID. This morning, similar scenes too early in the pandemic, with long lines for testing and the scramble for boosters as new cases and hospitalizations soar in parts of the U.S. Now, concerns growing about the rapid spread of the more contagious, highly mutated Omicron variant.
In the next few weeks, as we come to the end of December and the beginning of January, that we likely will have Omicron as the dominant variant in our country.
This as new guidance from the CDC raises new questions about the Johnson & Johnson vaccine. We have team coverage with everything you need to know ahead of the busy holiday travel week. Taking the stand, former police officer Kim Potter expected to testify in her own defense in the shooting death of Daunte Wright. We're in Minneapolis with details from court, plus what to expect from the defense as the prosecution rests. Rescued, a happy ending after 2 months of uncertainty. 12 missionaries finally free after being kidnapped and held for ransom in Haiti. What we know about their conditions and the operation that led to their release. And critical need, a different, more urgent shortage this holiday season. Blood centers reporting the lowest levels of supply in years. We'll check in to see what's needed and how you can help. We've had a lot of stories lately about how you can help, which is so great, especially during this season of giving.
Yeah, and blood, we were hearing a lot about in Kentucky this last week, so we'll get more on that in a little bit.
Yes, we certainly will, but we start this morning with the U.S. on the brink of yet another COVID surge.
This time with two variants, Delta and Omicron. An average of 120,000 Americans are now testing positive for COVID each day. That's a 40% increase in cases from just 2 weeks ago. Now the CDC is making some ominous predictions, including a massive spike in new infections by the end of Christmas week, predicting up to a 55% increase. That would be 1.3 million new cases in just 7 days. The number of people dying day to day could shoot up 71%. The CDC says well over 15,000 people could die in a single week. Now, as cases go up, the lines for COVID testing are looking a lot like they did in 2020, getting longer and longer. I know I saw it firsthand walking home yesterday. The demand for testing is skyrocketing, and it is getting harder for people to get their hands on those at-home tests.
Health experts still say our best weapon in this fight is the vaccine. And now the CDC is telling people who still aren't vaccinated or boosted to avoid getting the Johnson & Johnson vaccine over those blood clot concerns. NBC News medical contributor Dr. Uche Blackstock is here to break down what that means for people who did get Johnson & Johnson. But first, let's go to MSNBC anchor Lindsay Reiser in New York City and NBC News medical reporter Erica Edwards with what we know right now about this spike in cases. Lindsay, good morning. We'll start with you out on the streets of New York City. So the COVID positivity rate here has doubled from last week alone. What are city officials saying about this increase? Are they worried they could see a surge months after, we fully reopened, New York City was back?
Joe and Savannah, good morning. We're talking about an increase in demand in testing. Look no further than this City MD here on 57th Street. This place is supposed to open right around now. People have been lined up for a very long time. The line now stretches down the block all the way to the stoplight on the other side of the street. And we're seeing people wanting to wait in line because they're traveling. They want to see family. Some people have been told that somebody they know was exposed. Other people believe it's their civic duty. But we're talking about the alarming rise in cases, right? You mentioned the city's positivity rate doubling week over week to 7.3%. The numbers lag a little bit, so that number was as of Sunday. It could be different now. But also, the governor of New York tweeted an alarming statistic, too, about 18,276 cases. She tweeted that yesterday for Wednesday's total. That's the highest total since January, since the winter surge, and it's also a 40% jump in 1 day. And so when we talk about the Omicron variant and Delta, we know Delta is still predominant here. But take a look here at the numbers for Omicron, because the CDC says New Jersey and New York are seeing rates at 4 times the national average. So we're talking about 13.1% of positive cases are Omicron, compared to the U.S. average of 2.9%. The governor is calling this a public health crisis. She says right now that now is the time, of course, to get boosted. Let's also listen to the city's health commissioner about the alarming trend that we're seeing.
Unvaccinated New Yorkers are 8 times more likely to have a COVID-19 infection, and they're 13 times more likely to be hospitalized with COVID-19. If we use the tools that we have, we will be able to turn the corner on the pandemic. Booster doses are a near-term focus for us.
Now, the incoming mayor of New York City, Eric Adams, says it's going to take a lot for him to lock down the city again. We're not at that point yet, but he is not taking off the table the possibility of using Javits as a field hospital again, Joe and Savannah.
So, Eric, beyond New York, the uptick in cases is also on the minds of top health officials working with the White House. What are they expecting over the next few weeks?
Yeah, good morning. Well, really nationwide, officials are bracing for exactly what Lindsay was just talking about, a convergence of two highly transmissible variants, Omicron and Delta. Delta, of course, is continuing to lead to a surge in cases, hospitalizations, and sadly, even deaths around the country. Now, yesterday, Dr. Fauci told NBC News that he fully expects things will get worse as we enter the depth of the winter, especially with those fast-moving Omicron cases. He and other public health officials briefed President Biden on the situation yesterday. Afterward, the president reiterated that vaccination is key. Here's what he had to say.
The whole point is Omicron is here. It's going to start to spread much more rapidly at the beginning of the year. And the only real protection is to get your shots. If you get one shot, if you haven't gotten it yet, that'll help. If you're at the point where you have everything, including your booster, you're in really good shape.
Now, everyone ages 16 and over is eligible for that booster shot. Joe?
Now, Lindsay, we just saw that line at the City MD that you're at, and as Joe said, he saw it on the way home. I've been seeing it all over the city. It's not just the location you're at. I've also been hearing that getting those rapid at-home tests from any type of pharmacy in the city is getting tough. Many of them don't have them. What is the city doing to try to make sure everyone has access to a test as we head into Christmas next week and we're seeing this surge?
So the city says they're going to be giving out 500,000 rapid at-home testing kits and 1 million K95 masks. They're going to be giving those out to community organizations. They're also going to be expanding hours at fixed city testing sites and adding more mobile sites. And while the people I talked to in line, they weren't bothered. They said, look, I'm glad people are getting tested. This is what we have to do. I did talk to Dr. Uche Blackstock last night, who I know you're going to be speaking with just shortly. And I asked her, what do you think about these lines? And she agreed that it was crazy that at this point in the pandemic, we are still seeing lines like this. So definitely some people are calling for more action, Savannah.
And Erica, hospitalizations are starting to slowly tick back up. A lot of hospitals around the country are dealing with staffing shortages. What are some of the ways hospitals are trying to make sure they're prepared for a potential influx of patients?
Yeah, so there are some major hospital systems, Cleveland Clinic, Intermountain Healthcare in Utah, that are actually dropping their vaccine mandates for staff in order to keep as many of those staff members as they can, especially nurses. I think any doctor worth her salt will tell you that it's really the nurses who do the bulk of the heavy lifting in hospitals. Some healthcare systems have actually turned to nursing schools to try to train as many nurses as quickly as they can. And one official at Jackson Memorial Health in Miami actually said that they're reaching out to hire nurses even before they get their licenses. Joe, Savannah.
All right, Erica and Lindsay, thanks so much. Appreciate your reporting.
Overseas, the Omicron variant is driving yet another wave of COVID. The UK is seeing its highest number of cases ever, nearly 2 years into the pandemic. Now, nations across the continent are racing to vaccinate and boost their residents, and in some cases, reimpose lockdowns. NBC News foreign correspondent Matt Bradley, has the latest from London.
In a sign of what could be to come in the U.S., countries across Europe are scrambling to deal with a crushing wave of COVID, now compounded by the highly contagious Omicron variant.
No one should be in any doubt. There is a tidal wave of Omicron coming.
The UK shattering its daily case record, nearly 90,000 new infections reported just today. Health officials racing to get all adults boosted by the end of December.
We're not closing things down. We're not asking people to cancel things. The sensible thing to do is to get boosted now and exercise caution.
Germany pushing boosters too, but warning there's not enough supply. Now negotiating with neighboring countries to secure third doses for more than 50 million people. In France, ICUs again overwhelmed, this time with mostly unvaccinated patients. Nurses there exhausted. We want to call on people to get vaccinated, she says, to help the patients here who are immunocompromised who get vaccinated, who respected all the rules. With 1/3 of Europe still not vaccinated, more countries are moving to reimpose strict COVID measures. Denmark this week returning to remote learning, also closing bars, restaurants, and nightclubs. In the Czech Republic, officials banning Christmas markets and the drinking of alcohol in public as part of a 30-day state of emergency. In Italy, all unvaccinated visitors are again required to quarantine upon arrival. And in Austria, all adults will be required to get the vaccine, beginning in February. Those measures prompting demonstrations across the continent. Tens of thousands marching in protest of lockdowns and vaccine mandates, at times turning violent. But with just 60% of Americans fully vaccinated and less than 1/3 of those people boosted, health officials in the U.S. are already sounding the alarm.
I think we're already seeing a really terrible wave in real time. We're just sort of numb to the figures at this point. So I think that lag time between what Europe used to experience and then us experiencing it a few weeks later, I think that's been erased entirely, and we're still dealing with dual threats right now.
And that was Matt Bradley with that report. Thank you, Matt.
NBC News medical contributor Dr. Uche Blackstock joins us now. So, doctor, given what we're seeing here and around the world, what do you think the next few weeks hold for us? And what's your advice to people now this holiday season?
Thanks so much for having me on, Joe. I think we need to brace for probably what we may see as the worst of the pandemic so far, with two highly transmissible variants, with waning immunity, with people spending more time indoors, and the fact that we have a significant minority of people who are unvaccinated. We probably are going to see an explosion in cases. And so that's why it's even more imperative for folks to follow those mitigation measures that we know work so well and that are the foundation of public health: high quality masking, getting tested, but we see that the testing capabilities are not up to snuff. So they have to do their best with testing and, physically distancing and keeping your gatherings small with vaccinated people.
Let's talk about one particular vaccine, that's Johnson & Johnson. The CDC now telling people get Pfizer or Moderna because of the risk of a rare but potentially life-threatening blood clot if you can get those. So if you did get J&J or got the J&J booster, what should those folks know about this? How concerned should they be?
Yeah, I would say for people who have received Johnson & Johnson already and they're more than 2 weeks out, there's very, very little concern. This side effect was seen within the first 9 days after the shot. It still is quite rare. It's mostly seen in women in their 30s to 40s. And so, again, if you've gotten the Johnson & Johnson more than 2 weeks out, you shouldn't be alarmed. If you're less than 2 weeks, look out for symptoms like headache, change in vision, and anything else that seems out of the ordinary.
So, doctor, do you still have a strong level of protection against Omicron if you did get J&J? I know we're still learning a lot about the Omicron variant, but what do we know about that variant when it comes to J&J?
Right. So there are some lab studies. We don't have clinical data, real life data yet. We have some lab studies that show that the Johnson & Johnson vaccine may indeed be less effective against Omicron than the mRNA vaccines, which is one reason why the CDC encourages this mixing and matching. And we're seeing with mixing and matching, if you follow the Johnson & Johnson with an mRNA vaccine, you have a more robust immune response, greater effectiveness against coronavirus, including the variants as well.
All right, Dr. Uche Blackstock, as always, thanks for answering our questions. We appreciate it.
And we'll have more COVID coverage throughout the show. But now to the latest in the trial of former Minnesota police officer Kim Potter. The prosecution wrapped up its arguments yesterday, and now the focus turns to Kim Potter's defense team. The former police officer agreed to testify in her own defense, and we could see that happen sometime this morning. NBC News correspondent Shaq Brewster joins us now from outside the Hennepin County Courthouse. Shaq, good morning. So walk us through what we could expect to hear from Kim Potter herself this morning and what her defense team will try and prove to the jury today.
Well, we expect to hear Kim Potter testify that the use of gun was a mistake, but that the use of force by an officer was necessary because, in the words of her defense team, they couldn't let 20-year-old Dante Wright get away. And that's what we expect to hear from Kim Potter after what has been a day of testimony from the defense where they really tried to poke holes in the case that was laid out by the prosecution. Remember, the prosecution is arguing that even if Kim Potter intended to use her taser, that was still an excessive use of force, and that wasn't justifiable. But the defense has been putting on witnesses saying that her use of force was appropriate and that even if she intended to use a gun, that was necessary and that was appropriate because of the chaotic situation that existed. So we'll expect to hear from Kim Potter in her own words today. We know that she's been emotional throughout the trial. She was emotional in the direct aftermath of the shooting. So we can expect to see some emotion from her when she takes the stand today.
And Shaq, you just referenced some of these other witnesses we heard from. Some of those people happen to be Potter's former boss and 2 use of force experts. Yeah. Tell us some of the highlights from those testimonies.
Well, you heard the use of force experts say that she did not violate policy or the law when she shot Dante Wright, and she didn't violate policy by trying to reach for her taser. And you also heard that from the former police chief of the Brooklyn Center Police Department. This is a police chief that was forced to resigned in lieu of termination because after his review of the situation, his review of Kim Potter's body camera, he decided that she didn't act inappropriately. Listen to what he testified to on the stand yesterday.
When I viewed both camera angles and had all the data in front of me, I saw no violation.
No violation of what?
Of policy, procedure, or law.
And the policy and procedure at Brooklyn Center Police Department, to your knowledge, since you're the chief, followed the law of use of force, is that right?
Yes, it does.
So is it your opinion that not only could a taser be used in this chaotic situation, but also a gun? Is that right?
That is correct.
Now, for both the former police chief and the defense's use of force expert, you heard during cross-examination the prosecution try to highlight that these are people who were sympathetic to Kim Potter, that they've had a long history in law enforcement. For the police chief, he and Kim Potter went to social events together and talked on the phone regularly. So they tried to suggest that these aren't impartial players in this process. But we also heard the defense bring up some character witnesses, and each of them talked about Potter during her tenure, her 26-year tenure in the police department, calling her a kind person, a patient person, someone who was a good trainer and who had a good reputation in this department. Remember, the defense's job is to poke holes in the prosecution's case, and they used some pretty big witnesses yesterday to try to do that.
And Shaq, just quickly before we let you go, what can we expect here in terms of a timeline? Are more witnesses expected to take the stand next week?
Well, the prosecution has wrapped up their case. We know the defense, they're likely to call 2 people today, according to some of the courtroom conversation. It is possible, based on those opening statements, that these are the final witnesses the defense will call, which means if there are no rebuttal witnesses, which we don't know for sure, this can be in closing arguments by Monday, and it's potential that the jury can have this in their hands by Monday afternoon. Again, that's me making a couple of assumptions based on courtroom conversations, but that's kind of the timeline that we're looking at this point.
All right, Shaq Brewster, thank you so much. Stay warm out there.
A search warrant has been issued for Alec Baldwin's cell phone nearly 2 months after that fatal shooting on the set of his movie Rust. This all comes just 2 weeks after Baldwin spoke publicly about the incident for the first time as the investigation ramps up. NBC News legal analyst Danny Ceballos joins us now to explain what all this means. So, Danny, what more can you tell us about this warrant? What could it mean for the investigation and potentially for Alec Baldwin?
It's curious that this warrant application comes just about a week or so after Alec Baldwin sat down and gave an interview, thus suggesting that if you're a celebrity and you try to get out there ahead of the problem, that authorities are going to be watching very closely. And they may be looking to see if Alec Baldwin made any statements after the shooting as to whether or not he, in fact, pulled the trigger, because he denied it in an interview on TV. Other than that, this is an unintentional shooting. So they can't possibly be looking for text messages before the shooting where Alec Baldwin says something like, "Gee, I can't wait to shoot a live gun on set." That seems incredibly unlikely. but I guess anything's possible.
And Danny, we are hearing a response from Alec Baldwin, his attorney, on this, right?
Yeah, and I got to tell you, I would be mighty upset if I were Alec Baldwin's defense team. You have to understand that a search warrant is a complete invasion of privacy, but a search warrant of a cell phone is something the founders probably never anticipated. Our cell phones carry data and information about us that is almost as complete a picture of our inner thoughts as you could find. So the law is pretty clear that if a search warrant is valid, if they stumble upon anything bad about you, then that is fair game for prosecution. So I would be very concerned if I were the defense.
And I do believe we have a statement from Baldwin's attorney. If we have that, I do want to put it up just to give us a chance to react to the affidavit. It said, we proactively requested that the authorities obtain a warrant so that they could take steps to protect Mr. Baldwin's family and personal information that is clearly unrelated to the investigation. A phone contains a person's entire life and personal information needs to be protected. While they evaluate the phone information, we hope that authorities continue to focus on how the live rounds got on the set in the first place. Now, Danny, there's still so much confusion about this shooting, mainly surrounding who was responsible. Alec Baldwin sat down for his first interview about the incident 2 weeks ago. Let's listen to some of what he said.
Well, I didn't pull the trigger.
So you never pulled the trigger?
No. I would never point a gun at anyone and pull a trigger at them, never.
Do you feel guilt?
No. I feel that there is, I feel that someone is responsible for what happened, and I can't say who that is, but I know it's not me.
So the big question, who was responsible? What are we hearing from the other people involved, like the film's assistant director and the armorer?
A lot of what you hear about them is even in the warrant application that we just saw. Of course, those folks have denied responsibility. The armorer has even said that she's never had a problem like this on set, and that in her belief, there were no live lethal rounds on set. But the warrant application does seem to suggest that folks beyond Alec Baldwin may have responsibility. I mean, after all, a warrant application is supposed to have probable cause that contraband or criminal activity evidence will be found in the place to be searched. And in this case, that place to be searched is the vast data trove in Alec Baldwin's cell phone.
Now, Danny, of course, there were two victims in this shooting. The film's director, Joel Souza, was wounded, and the cinematographer, Helena Hutchins, was killed. What kind of legal action could Joel or Helena's family take? And do we know if they've even done anything like that yet?
There are absolutely options for civil liability. And while there may, and I stress, may be some workers' compensation bar, I doubt that's the case. These were probably all independent contractors to some degree. And so you're going to have so many different layers of companies that were there and so many different layers of insurance. Even though this was a low budget, or it's been described as a low budget film, there almost surely were many layers of insurance and many different levels of negligence, arguably spread out among many different people.
All right, Danny, thanks so much for your analysis. We appreciate it.
All right, it's of course been a week of extreme weather. Let's get a check on where that's at with our Morning News Now weather forecast.
Hey there, Bill.
Hey, good morning. So I have a more typical forecast. I got a little snow to talk about, some rain, and some colder temperatures. So, yeah, finally it's returning a little bit to normal, but I'll start with telling you New York City set a record high this morning at 5 a.m. of 59 degrees at LaGuardia Airport. So there's still a lot of unusually warm air that is beginning to head out. So the big story today, we're going to have some bad weather returning to those areas that a week ago had those horrific tornadoes in Arkansas, Tennessee, and especially Kentucky. This is not going to be a storm like that one, but we are going to have isolated severe weather. We're going to have some rain. So it's kind of the first bad weather they've had since the tornado struck. So obviously it's not going to help with cleanup efforts, but it can't be clear and nice forever. So, a few strong storms this evening. I'm mostly talking about areas of Oklahoma, possibly North Texas, into areas right around the northwestern corner of Arkansas. And then on Saturday, that rain moves right through the state of Kentucky. And that blue on the map shows you some snow on Saturday in northern New England and a little bit of icy weather there from the Catskills to central Mass and areas of Hartford. By Sunday, everything kind of clears out. So as far as severe weather goes, this will be isolated severe weather, maybe some hail, some damaging wind. The chances of any tornadoes are very low, but not impossible. So from Sherman, Texas, northward to Ardmore, heading up almost towards Fayetteville, Arkansas. And because of the heavy rain threat, we do have a flash flood watch from McAllister up to Fayetteville. We could get some quick stream rises. That area could get about 1 to 2 inches of rain. But again, I'm not expecting any huge issues. So for Saturday's forecast, there's that snow, sleet, freezing rain, all possible in areas of New England. And as far as snow amounts go, not a huge blockbuster event, guys, but I'm sure the skiers and snowmobilers will take whatever they can get because they haven't had much, about 2 to 6 inches there in northern New England. But for the big cities, you're going to have to wait. And we'll talk more about that next hour. I'm going to go out on a limb and take a look at next week's forecast leading up to Christmas.
Ooh, a Christmas forecast. Then maybe New Year's, too.
Danger.
All right.
Thank you, Bill.
Thanks, Bill. Coming up, finally free, a happy ending to that hostage situation in Haiti.
We're not hearing anything. We have heard nothing as far as their condition. We just simply know that they're free, and we're rejoicing in that.
The final 12 missionaries, 11 of them American, now free after being kidnapped 2 months ago. What we know about their rescue and the efforts now to get them back home. That's next on Morning News Now. Welcome back. The remaining 12 members of a missionary group kidnapped 2 months ago in Haiti are free this morning, and we're learning new details about the rescue effort. NBC News Chief Foreign Correspondent Andrea Mitchell has more.
Joy at the offices of the Christian Aid Ministries in Haiti at word that their 12 remaining missionaries had been released, exactly 2 months after they'd been kidnapped. Haitian police confirming the release, but offering no details about how they got out and whether anyone paid the $1 million ransom the kidnappers had been demanding for each. Originally 16 Americans and 1 Canadian, including several children. With the FBI leading the rescue efforts, 5 of the hostages had gotten out in recent weeks. The Ohio-based missionary group issuing a statement saying, "Join us in praising God that all 17 of our loved ones are now safe." Haiti has dissolved into lawlessness since the assassination of its president in July and a devastating earthquake in August. In the chaos, criminal gangs like this one, believed to have taken the missionaries, becoming even bolder. In Michigan tonight, the pastor of some of those released.
We're not hearing anything. We have heard nothing as far as their condition. We just simply know that they're free, and we're rejoicing in that.
Do you know if the U.S. government helped in getting their release?
The FBI was involved. I do not know to what extent. I do not know what the final terms were. I just know they're free.
All right, Andrea, thank you so much for that report.
Now to the battle over COVID vaccine mandates. Earlier this year, the Pentagon set a deadline for active duty troops to get vaccinated, and that deadline passed this Wednesday. NBC News Pentagon correspondent Courtney Cubey reports on new data released by the Army showing how many soldiers complied and what comes next for the thousands who did not.
Savannah and Joe, now that the deadline has passed for all active duty U.S. Army soldiers to be vaccinated for COVID, the U.S. Army has put out their figures for just how many of those soldiers refused to get the vaccine on time. We now know that more than 3,800 active duty soldiers have refused to get the vaccine. Now, more than 98% of all of the active duty force got at least one of the shots. 96% had 2 shots, 98% had at least 1, but that still leaves a portion, thousands of soldiers who weren't vaccinated on time. There's still a number of them who are in an exemption process. They've requested an exemption either for medical reasons or for religious reasons. So far, only 4 soldiers have been granted that medical waiver or exemption. None have been granted for religious exemptions. But what happens now is commanders, U.S. Army commanders, can help to counsel some of these soldiers who are refusing the vaccine to try to convince them why it's important for them to get it. The military's reason for it is a readiness issue. They're saying that soldiers who work in close proximity, they travel, they train, they often are deployed in close quarters, that for the safety of those individuals and others, they need to be vaccinated. If those 3,800 plus soldiers still refuse after the counseling period, though, they can be processed for administrative separation. We've already seen that happen in the Air Force earlier this week, the Air Force announcing that 27 airmen had been processed for separation for refusing the COVID vaccine. Joe, Savannah.
All right. Thank you, Courtney. Time to take a look at what's making news around the world this morning.
Raf Sanchez joins us today from Tel Aviv. Hey, Raf.
Savannah, Joe, good morning. Dozens of people are feared dead in a fire in Japan. At least 27 people are thought to have been killed in a psychiatric clinic on the 4th floor of a downtown building in Osaka. Police say they're investigating whether the blaze was started deliberately. This comes 2 years after arson killed 36 people at a Japanese film studio. The U.S. has strongly condemned a shooting attack in the occupied West Bank in which one Israeli was killed, 2 more wounded. The shooting happened late last night and has been celebrated by Palestinian militant groups, the Israeli military launching a sweeping manhunt for the shooters. And finally, forget bear hugs. The internet is going crazy for lion hugs. Surga is a 10-year-old lioness from Botswana, and she's going viral on TikTok with videos showing her wrapping her caretaker in massive hugs. Guys, that caretaker says lions are not dangerous to humans if you know how to behave around them, which sounds like a giant if to me.
Yeah, no kidding. You also have to, it looks like, be very strong.
Yeah, and like, aren't there nails?
It's not a
but
tiny
it's
lion.
Cute.
Yeah.
I mean, it's sweet to see.
Yeah, good for them.
Yeah.
We'll enjoy and
Don't
watch.
try this at home, that's
All
for
right.
sure.
Thank you, Raf.
Thank you. Coming up, closing arguments are now underway in the trial of former Theranos CEO Elizabeth Holmes.
Prosecutors trying to tear down her defense, saying she knowingly lied to investors. We have the latest from court when we return here on Morning News Now. Betty White is turning 100 years old next month, and she wants everyone to celebrate with her. The beloved Golden Girl is inviting fans to join her birthday celebrations with a special movie event. It's going to look back on her long career with a star-studded cast, including Ryan Reynolds, Tina Fey, Robert Redford, Carol Burnett, and Clint Eastwood. Betty White, 100 years young, a birthday celebration. That's what they'll call it. It's going to screen in 900 theaters on White's birthday, which is on January 17th. I believe that's also Martin Luther King Jr. Day, so maybe some folks will be off and can, catch it at the theater.
Yeah, absolutely. Oh, how exciting. 100. Wow.
Yeah, I know. It's
what
amazing.
A life she's lived in those 100 years.
She trends every few weeks, it seems like, on the internet because people just want to make sure Betty's okay. So
Exactly. All right. Thanks, Joe. Yep. Now, after 11 weeks, attorneys are delivering closing arguments in the trial of former Theranos CEO Elizabeth Holmes. Holmes is charged with 9 counts of fraud and 2 counts of conspiracy for allegedly defrauding investors and patients about her company's technology. If convicted, she could face up to 20 years behind bars. NBC News senior business reporter Ben Popkin has been following this trial closely and is here now with the latest. It was a long one, Ben, so thank you so much for following it so closely. So the defense will likely wrap up its closing argument today. What points are both sides really emphasizing to the jury with this last chance?
And good morning. Yesterday, the prosecution methodically recapped its case that faced with business failure, Elizabeth Holmes instead chose fraud. She created a $9 billion company with a promise to revolutionize blood diagnostics, created this device called the Edison that she said could perform hundreds of blood tests. But they said it could actually only ever do a handful, and poorly at that. And when these faulty devices were being rolled out to Walgreens, she switched to using other companies' machines, the very technology she was trying to disrupt, to perform the actual test without telling her investors or the press. And this is key to the fraud. And she also told people that her devices were being used in military helicopters in Afghanistan when they were not. 6 witnesses, including former Secretary of Defense James Mattis, who was on her board, testified that she led them to believe that. The defense, for their part, they says that Elizabeth Holmes acted in good faith and that the government really failed to prove that she acted with intent to deceive. Even if she made these misleading statements, at the time, Elizabeth really believed in them. She really believed that her company was going to achieve these goals. So therefore, she wasn't acting with intent to deceive and can't be accused of fraud. We'll be looking to see how they handle some of the more emotional claims brought up earlier as defense closes their arguments, finishes today.
So, Ben, I mentioned this was long. It was pretty lengthy, 11 weeks with 29 witnesses called to testify in total. That included Elizabeth Holmes herself. In addition to it being lengthy, I mean, this is something that just had so much media coverage, books, podcasts, documentaries, even before this trial. People know a lot about this, but walk us through some of the biggest revelations, even with people knowing so much, that came out of all that testimony, all those witnesses.
Well, some of the biggest bombshells have come from Elizabeth Holmes herself. One, admitting that she personally was the one who had added the logos of pharmaceutical companies to reports that Theranos itself had written, making it look like these companies endorsed their findings without their knowledge or authorization. She then passed those off to investors and business partners, and including the former Trump Secretary of Defense, Betsy DeVos, her investment office, who believed that these false claims were what led them to invest in the company. Another stunner, she disclosed for the first time to the public that she had been raped while a student at Stanford at age 19, and it was this that led her to pour herself into the company, drop out of Stanford, and also into the arms of Ramesh Balwani, software executive, 20 years her senior, who became her boyfriend and CEO of her company. She later accused of physical, mental, sexual abuse, of claims that he strongly denies. These two bombshell revelations stun even close court watchers who have been following every tick and talk and all the documents in this closely watched case.
And Ben, quickly, it's going to head to the jury soon. What do we know about them and what that process will look like?
We've got 8 men and 4 women. Unique, they've been chosen because they had little knowledge of the home story, which, due to the coverage, has been hard to achieve. They've been hard to read, not really showing emotional reactions, but they've been very attentive. The case will be in a jury's hands when closing arguments finish today. As early as this afternoon, deliberations expected to stretch into next week, but everyone is looking to see if there will be a verdict delivered by Christmas.
All right, Ben, thank you so much.
The defense team for Ghislaine Maxwell started calling witnesses to the stand after several of her accusers outlined graphic details about alleged abuse by Jeffrey Epstein. At least 35 witnesses are expected to testify on Maxwell's behalf, but it's unclear if Maxwell herself will take the stand. NBC News correspondent for investigations Tom Winter joins us now from outside the New York City courthouse. So, Tom, good morning. Yesterday we heard from defense witnesses, including Maxwell's assistant. What did we learn from them?
That's right, Joe. Kimberly Espinoza taking the stand yesterday is the first witness in the defense's case, which is expected to last perhaps just another day or a day plus. Basically, she came forward and talked about how she saw Jane, one of the alleged accusers in this case, at the Epstein offices. Now, it's important to know she did not work at the houses, and she said that when questioned by prosecutors. Instead, she worked for the J. Epstein Company, originally as a member of the executive team for their attorneys, and then later on worked as an assistant for Maxwell. She says she didn't see anything inappropriate. She did say when it came to that alleged victim, Jane, that she thought she and Epstein were in a loving relationship. So that's how she described it. That was their first witness, a couple of defense experts from there, but that's what we heard from yesterday, Joe.
Tom, the big question everyone's still asking, what's the latest on whether Maxwell is going to take the stand herself?
Yeah, I think based on what the defense attorneys telegraphed yesterday after court ended, after the jury was out in front of the judge on their timing, and based on legal experts that we've talked with, the types of questions that could come up on cross-examination for Maxwell, I think it is at this point highly unlikely that we'll see her take the stand, Joe.
And quickly, Tom, what's next and when might this case actually go to the jury?
Yeah, it could go to the jury as soon as late Monday afternoon or first thing on Tuesday morning. The defenses are going to call one witness potentially early Monday morning, but they said that's going to be a very short witness. In their words, another telegraph that it's probably not going to be Maxwell. That means closing arguments on Monday. After that, the jury gets charged, and they could begin deliberations as soon as late Monday or early Tuesday morning. Court's in session only for Tuesday and Wednesday of next week after Monday's defense presentation. So, and then at that point, they break for Christmas holiday, Joe.
The holiday is coming. All right, Tom Winter, we know you'll keep an eye on it. Thank you. Coming up, an urgent plea from blood centers as the supply dips to dangerously low levels this holiday season. We'll talk about the shortage and how you can help.
And recall alert after the break, the popular drinks being pulled off the shelves in several states in this week's Good to Know.
The FDA is now permanently allowing patients to access abortion pills through the mail without meeting a doctor in person for the prescription. The move comes as the Supreme Court debates the future of Roe versus Wade, a precedent that made abortions legal nationwide back in 1973. With this FDA change, patients can now virtually meet with a doctor to get the prescription. The move will bring abortion access to millions of people who struggle to find providers close to home. This year, at least 16 states have introduced bills to restrict access to medically induced abortions.
We've covered shortages all throughout the supply chain crisis this year, from the recent cream cheese crisis to semiconductor chips. But this one's serious. This morning, we want to discuss the shortage of a life-saving resource that you can actually do something about: blood. The nation's blood centers are reporting dangerously low levels of supply this holiday season, and they're asking for help. Dr. Claudia Cohn, Chief Medical Officer of the Association for the Advancement of Blood and Biotherapies, joins us now. Good morning, Dr. Cohn. Thanks for your time. So first, just give us a sense of how dire this shortage has become at blood banks and what the ultimate implications are because of that.
Good morning. Thank you for having me. The situation has become quite dire. We usually have 5 to 7 days worth of blood on the shelf at blood centers. At the beginning of COVID, when we began to have restrictions in social distancing and fewer people could come out, we dropped down to about 3 days worth of supply, and we went from what we considered a status green to a status orange. Now, because of supply chain, et cetera, we're down to 1 day supply in some regions of the country. Wow. So that is as low as we've ever been, that I've ever seen.
So what is driving this shortage? Is it supply chain? Is it COVID? A combination of all that?
It's a combination. Let's begin with the idea that the best donors are baby boomers, and they're beginning to age out. They come regularly, they come often, they're wonderful. Oh. They're not being replaced by the younger generation. So at the very beginning at baseline, we're tenuous. And then COVID hit, and we couldn't have mobile drives because of social distancing. And so we're limited to fixed sites, the blood centers themselves. And add to that now COVID fatigue, fewer people just want to do things because they're tired. And then finally, the fact that there are staffing shortages. So blood centers cannot operate at full capacity.
Oh, so much working against us there. Now, also, yes, in addition to everything that you just laid out, actually during some of COVID, it was actually put on hold, blood donations at the height of the pandemic when we weren't sure what was safe, essentially, as we learned more. Now that we're seeing the spread of Omicron, of this new variant that seems to be quite transmissible, is it safe to be donating blood? Are there any precautions set up to prevent the spread of COVID while doing so? And what does it mean for that blood?
So donations were never actually halted. It was just social distancing initially made people afraid to come out. But I'd actually say it's safer to go to a blood center than to go to a sporting event, to go to a local grocery store, to go to the mall for Christmas shopping. We stagger appointments so that we have a limited number of people on site. We use social distancing, of course. Everyone wears a mask. Surfaces are wiped down so that everything is very clean. And we only want healthy people to come out and donate. You're not allowed to donate if you're not feeling well. Mm-hmm. So you're surrounded by healthy people. It is extremely safe to donate, and you cannot contract COVID through a transfusion. Everything about it is quite safe.
I think that right there is the big key people are wondering. So that's great to hear. Finally, of course, what can we do to help? Is it as simple as finding those blood centers and heading in?
Yes. If you go to aabb.org, there's a blood locator. So you can just put in your zip code and it will tell you the blood center near you. One thing I want to warn everyone is you might call up tomorrow to make an appointment to donate, and they'll tell you, we can't take you until 3 weeks from now. It is not because we're out of a shortage. It is simply because of staffing shortages or because they're trying to stagger the supply so that there's enough. Blood has a short shelf life. And so we have to constantly keep the people coming through the door. So please get out and give some blood and do it regularly. Make it a part of your life so that every 8 weeks you go and donate blood. It's a great way to give back to the community. It's a great way to save a life.
Oh, wow. Powerful message there. And great point that if you're told come back in a few weeks, stick with it. It's not because they don't need it. Dr. Claudia Cohn, thank you so much. Really great information there. Happy holidays.
Thank you for having us.
And it's time now for our CNBC Money Minute, the biggest financial headlines of the day and why they matter to you.
Silvana Henao is with us this morning. Good morning, Silvana.
Hey guys, good morning. Happy Friday. So Kellogg and the union representing 1,400 workers at its U.S. cereal plants have reached a tentative deal on a new 5-year contract. The workers have been on strike since the beginning of October and rejected a previous deal earlier this month. At the time, Kellogg said it would permanently replace them, a move criticized by President Biden. If they vote in favor of the new deal, the workers could be back on the job just after Christmas. Meanwhile, Lime is eyeing a big expansion push. The CEO of the e-scooter startup telling CNBC the company plans to launch service across the Middle East over the next 2 years. It's running a small trial now in Dubai. Lime, which is based in San Francisco, recently raised about $500 million, and it plans to go public sometime in 2022. And Anheuser-Busch will roll out a line of Bud Light hard soda next month in cola, cherry cola, orange, and lemon lime flavors. Bud Light Seltzer Hard Cola will have no sugar or caffeine with 100 calories and 5% alcohol. The announcement follows similar moves by PepsiCo, which will introduce a hard version of Mountain Dew next year in partnership with Sam Adams maker Boston Beer. Guys.
I guess that was inevitable, right?
Yeah. I guess Mountain Dew sounds like it would work.
Maybe.
I don't know. Flavor-wise, I don't know. I haven't had a Mountain Dew in a
like
long
Mountain
time.
Dew. All right. All right. That's the perfect segue for our next segment here. Your favorite drink could contain metal parts. Get ready to pay more to watch TV. And how would you like $20 to not make a popular dessert? I'd be rich.
Right. Sound interesting? There was a lot there. It must mean it's time for one of our favorites. Good to know. Here's our friend, NBC investigative and consumer correspondent Vicki Nguyen.
Good morning, Savannah and Joe. Let's begin with breakfast. Before you take another sip, check your juice. Coca-Cola has issued a voluntary recall of some Minute Maid products over concerns the drinks might contain metal parts. The recall affects the following drinks sold in 59-ounce containers: Berry Punch, Strawberry Lemonade, and Fruit Punch. The drinks were sold in 8 states across the country. Just go to the FDA website to see if your products are part of that recall. Coke did not respond to our request for comment about whether it's received any complaints of harm. Grocery delivery is now more accessible to people of all income levels. Instacart is expanding service for customers who rely on SNAP benefits. The option to use SNAP payments through Instacart is now available at more than 5,000 stores nationwide. The company also said it is going to waive delivery fees for SNAP users. Inflation now hitting your entertainment options. DirecTV announced it's raising prices for some services beginning in January. The company says the increase due to higher supply costs. It joins other TV providers hiking prices, including Comcast and Disney. Comcast, by the way, is the parent company of NBC Universal. Skip making the cheesecake and actually earn money? Yes. To deal with the cream cheese shortage, Kraft is actually paying people $20 to buy another dessert. All you have to do is submit a receipt showing the alternative dessert you purchased. But act fast. The offer ends Christmas Eve, and it's limited to 18,000 shoppers. You can submit your receipt online. For News Now, I'm Vicki Nguyen, and that's good to know.
All right.
Always
you still
is.
have to do some work.
Yeah, exactly.
Okay. All right. Coming up, controversy in the world of college sports.
Yeah, why the record-breaking performances of a swimmer at UPenn are being called into question and renewing an ongoing debate about trans athletes. You're watching Morning News Now.
The historic performances of a swimmer at the University of Pennsylvania are getting a lot of attention and fueling a debate over transgender athletes in college sports.
That's right. Leah Thomas, a transgender woman who previously competed for 3 years on the men's team, has set school and national records in women's swimming since coming out as trans in 2019. NBC Out reporter Joe Yorkeba has been following this story and joins us now. Joe, good morning. So tell us about these records that she's set. That's part of what's drawing this attention, and then the reaction within the world of college sports.
Good morning. Sure. So Leah Thomas is a senior, and she has performed well at nearly every meet so far this season. But the media firestorm really began after her performance at the Zippy Invitational in Ohio earlier this month. And she won 3 events and set 2 national records there. And the reaction in the world of college sports has been really mixed. There are some folks who don't believe Thomas should be allowed to compete on the women's team at all because she went through male puberty. Others say that the rules that she's competing under should be made more strict. And then there are those who have defended her who say that those rules are completely reasonable and that this entire debate is really just the result of a few people who are upset that a trans woman has won something at all.
Leah, Joe, let's talk about some of the rules. Leah had to meet certain standards to compete on the women's team, which are enforced by the NCAA. What are those rules? How do they compare to other major sports governing bodies like the Olympics Committee?
Yeah, the NCAA requires trans women athletes to undergo at least 1 year of testosterone suppression treatment in order to compete on the women's team. And Leah, when she began competing in November at the start of the season, had completed about 2.5 years. And those guidelines are actually on the more strict end in terms of guidance set by sports governing bodies. The International Olympic Committee previously had similar guidance. It put a limit on athletes' testosterone levels and required some of them to undergo treatments. But the IOC released a new framework in November where it actually described those treatments as sometimes medically unnecessary without there being really clear scientific data that addresses the specific athletes and the sport in consideration. So the IOC has actually shifted the burden of proving that there is or isn't an advantage from the athlete onto the sports governing body, which is in contrast to the NCAA policy.
So, Joe, we know there really has been a lot of debate, as Joe mentioned at the top of this, about transgender athletes in sports. And then cases like these, it seems individuals like Leah become this sort of lightning rod around that debate, like shown as this example. But what research on a wider scale is there into the performance of transgender athletes? So we're not just talking about one, especially regarding the role testosterone plays.
Right. Yeah, there's actually very, very little research. I talked to Joanna Harper, who's a trans runner and researcher who's studying the effects of hormones on trans athletes now in England. And she released the first and only published data on trans athletes in 2015. And it evaluated the race times of 8 trans women distance runners after they had transitioned. And she found that they were no more competitive in the female division than they had been in the male division. And then there's one other often cited study published last year in the British Journal of Sports Medicine, which found that transgender women in the Air Force perform better on fitness tests after 1 year of hormone therapy when compared to cisgender women. And after 2 years, the study author told NBC News that their performance was fairly equivalent to cisgender women. But researchers note that that study wasn't on elite athletes, and it didn't study a particular sport. And that's why researchers like Harper say that there's an urgent need for more data to help create better policy.
All right, Joe, thank you so much.
And that does it for this hour of Morning News Now.
The news, of course, continues right now.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.